Welcome to Ask Dr. Clark, Sex Offender Education Series. I'm her producer, Tom. Dr. Clark, what are paraphilias? I guess what motivates them and what treatment options are available for them?
The word paraphilia is interesting. Para means outside the normal. Philia means arousal object. So someone with a paraphilia is aroused, sexually aroused by an object, not by a relationship. And it's usually something outside the normal, although normal is certainly a subjective term. So a paraphilic is someone who gets turned on by a behavior or an object, and that behavior could be watching other people who aren't aware of being watched, and watching those people undress, shower, having sex. And the paraphilic is called a voyeur. So that person is looking at people who aren't aware of being watched and becoming sexually aroused by doing that. You've probably heard of exhibitionism. That's someone who gets aroused by exhibiting themselves, either just exhibiting their bodies, their sexual organs, or exhibiting themselves having sex, doing some kind of sexual behavior. And that's what arouses them. But sometimes when we think about the stereotypical man wearing a raincoat and opening the raincoat and you see him naked, generally, that man will not have an erection at that time. What he's going to do is take a snapshot in his brain and go home and masturbate to the look on the victim's face. And that's what's getting him aroused. Of course, the big one with paraphilias is pedophilia. And pedophiles are sexually aroused by children. And with a pedophile, it's children who are prepubescent. We have another word for people who are aroused by postpubescent children. And there's two, actually, ephebophiles and hebophiles. The one that people certainly get worked up about is the pedophiles, with good reason. And a pedophile is someone who is sexually aroused, attracted to children as objects. And so even when they say they want to have relationships, that they love children, that they adore children, they want to have a relationship with a child, once that child ages out of that particular pedophile's template, then there's no more relationship. So a pedophile may or may not act out on their pedophilic urges and desires. That's a really important point, and we'll talk about them later, the non-offending pedophiles. Okay, know that they exist. So we don't all need to act out on our fantasies and desires. Some people have control, some don't. Some people want to have control, some don't. So the victim of a paraphile, any of our paraphilias, is someone who is an object to satisfy desire. So a lot of people are victims and they don't know it, but certainly if they find out, then they feel the effects of being a victim. They're going to feel shame, embarrassment, anger, some kind of trauma. And the way we treat paraphilics, because it's something that has to do with sexual arousal and desire, we want to decrease the sexual desire. We can try to shift the behavior. So someone who's an exhibitionist could maybe find ways to act out, meaning, but it's not going to be terribly effective because the whole reason they're getting so turned on is because of the shock that someone is expressing. So most of the time, if it's reached a point where it's causing a problem, where it's becoming sex offending behavior, then the goal of treatment is to decrease sexual desire. And we can do that with medication, we can do it with behavior modification, masturbatory reconditioning, where a person is masturbating to different arousal templates, We can try to shift that. But for the most part, if it's really bad, that person is looking at a life without sex. So that's paraphilias.